Good afternoon. I want to just do a quick review of one condition, which is peptic ulcer disease. Now, in this condition, I think it's very important that even before we go any further, remember the key terms. Number one, we said it's very important for you to understand this term, medical management. What should you write when a question is requesting that you write on medical management? Medical management entails that you are writing on one, the investigations, and secondly, the treatment or the drugs that are required to treat this condition. If a question poses a question is phrased in such a way that they want you to write on the nursing management, it means that you need to write what a nurse will do when this patient has been hospitalized. So the famous aprophenema comes to play. Now, if a question is phrased in such a way that they want you to write the management of this patient whilst probably hospitalization, it means that there are two key terms that are being brought together. Okay, we will have definitely the issue to do with medical management and then nursing management. When a question is phrased in such a way that they want you to write the nursing care plan. The famous table with 5 columns should be written. Now, quickly, let's go into the subject matter. Peptic ulcer disease, by definition, we said this is an erosion. Okay, it is an erosion of the gastrointestinal mucosa. And the cause, it's because of the digestive action of hydrochloric acid and pepsin. And you don't just add your definition on that point, you extend. Okay, you are extending your definition and they should be attached with characterized the word. The word characterized is a link. Okay, so characterized by, you mention some of the signs and symptoms of peptic ulcer disease. So critical to remember, a definition for it to be holistic and complete, it should have 3 components. Number one, you should mention the system that is affected. Secondly, you should mention what is causing such a condition. Then thirdly, you should attach to this definition some of the signs and symptoms. Now, it's very important again to remember the common sites for peptic ulcer disease. We have the lower esophagus, we have the stomach, we have the proximal portion of the duodenum, and we understand that the duodenum is part of the small intestine. Then apart from this, the other thing that is important for you to remember, it is the art of drawing this diagram. The diagram that you are not supposed to draw is a diagram of the stomach showing sites of ulceration, 3 sites of ulceration: the lower portion of the esophagus, the stomach itself, and then the duodenum, the proximal portion of the duodenum. Remember that peptic ulcer disease is actually classified pertaining to in 2 ways. Number one, the degree of the ulceration and the location. And in this discussion, what is very important is the location itself. Okay, then out of the 3 types of ulcers, which is esophageal ulcers, we have gastric ulcers and duodenal ulcers, of which these, what is very important and what is frequently discussed, it is the gastric ulcers and the duodenal ulcers. What is the difference between gastric and duodenal ulcers? Even before we go to the differences, what causes peptic ulcer disease? There is one bacteria that has been implicated, and that is the Helicobacter pylori. Then there are other factors or causes for peptic ulcer disease. Number one, emotional factors, inflammation. For example, if gastritis, acute or chronic gastritis, is not being controlled, it may lead to ulceration, and therefore this would be known as peptic ulcer disease. Heredity, you can inherit it, especially people with blood group what? O. okay? Then apart from that, trauma and serious illness, it may definitely lead to peptic ulcer disease. Prolonged use of irritants, and amongst these irritants, alcohol can be one of them. Then apart from this, we also have normal aging. You have just grown old, and definitely that will now result in these issues. On the pathophysiology, what causes ulceration is when there is a decline in the resistance of the mucosal lining, okay? When the mucoid a protector of one's lining of the GIT is inadequate, definitely we'll see now hydrochloric acid and pepsin taking a toll. So this is very, very important. Then apart from this, I also want to stress on one thing. I want to stress on the management that would give this patient. Number one, before we go to the management, maybe we can mention some of the signs and symptoms of peptic ulcer disease. Number one, epigastric pain, heartburn, vomiting, weight loss, dyspepsia, chest discomfort, anorexia, hematemesis, or probably Madena stool resulting from the gastrointestinal bleeding. Then apart from this, we also have at times constipation. Now, what could be um, the management of peptic ulcer disease? But before we go to the management of peptic ulcer disease, I want you to differentiate between the two types of ulcers. That's the gastric ulcers and the duodenal ulcers. Let's begin with the key characteristics. Number one, location of the lesion. So on the location of the lesion, gastric ulcers are located in the stomach, duodenal ulcers are located in the stomach. Then on the lesion, gastric ulcers, they tend to be superficial, duodenal ulcers, they tend to be deep. Then on the clinical manifestations, usually in gastric ulcers, pain would occur 1 to 2 hours after one has consumed meals. But in duodenal ulcers, it's about 2 to 4 hours. That's when one would definitely experience that pain. Then apart from this, gastric ulcers, they usually experience weight loss. Then in duodenal ulcers, they experience weight gain. What could be the reason? In gastric ulcers, when they have consumed food, they experience too much pain. So they do not want to continue consuming any food. But in duodenal ulcers, when they have taken food, that's when they feel even better. So they gain weight. When we come to the issue of bleeding, in gastric ulcers, this would be demonstrated as hematemesis. Then in duodenal ulcers, that would come as Malena stool. Then on blood group, usually in gastric ulcers, some have demonstrated that this is common in people with blood group A, and duodenal ulcers is very common in people with blood group O. Cancerous tendencies, gastric ulcers usually tend to turn into cancers, but duodenal ulcers, it's very rarely that they will turn into cancers. On the management, medical management, number one, history taking. Number two, physical examination, okay? Physical examination, important. On other investigations, we can do endoscopy. Then apart from that one, we can also do spatial or neurological examination. Stool examination can be done. Biopsy can also be done. On the drugs, our aim is to reduce pain. Secondly, we want to eradicate H. pylori, Helicobacter pylori. Then apart from this, we also want to heal this patient completely, and we do not want this peptic ulcer to reoccur. Okay? Now, the treatment for peptic ulcer disease, it is triple, meaning we are using 3 drugs, which myself abbreviate as AMO, AMO. Okay, A stands for amoxil, the M stands for metronidazole, the O stands for omeprazole. Let's begin probably with omeprazole. So this is given 20 milligrams orally twice daily for 4 to 8 weeks. Remember, when you are writing, you are not using any abbreviations, okay? Then apart from this, it would be very important for you also to write the action, the side effects, the nursing implications. Amoxil is 500 milligrams TTS orally, okay? Then for the metronidazole, we are using a tablet here. But if you are using IV, probably that could be 500 milligrams. But for a tablet, it's 400 milligrams 3 times daily. Then, apart from this, once you have given this patient this treatment, there are non-pharmacological intervention that you can also give them. This could be in form of IEC. So probably you would tell this patient that if they are consuming highly spiced food, they can reduce on that. If they are consuming foods that, of course, very spice, they can reduce on that. Okay. The nursing care, the nursing management, this again, we begin with aims to relieve symptoms, reduce anxiety, to maintain nutritional requirements, provide knowledge, prevent complications. And it would be very important that we follow the common approach enema. You write on admission, you write on position or psychological care, you write on the rest, observations, you write on nutrition, elimination, medication, exercise, and then you also end with the issue of giving advice to this patient. What could be some of the complications for peptic ulcer disease? So some of the complications could be peritonitis, gastric outlet obstruction, malignancy, penetration. Okay, so anemia can also be there. So briefly, in these few minutes, 11 minutes, 16 seconds, we can end here as a quick review of peptic ulcer disease. So if you have any question, please don't hesitate to ask.